So the One-Stop Pituitary Clinic is a clinic in which we have combined all the assessments that are required for good assessment of patients with pituitary problems, that all of those assessments are done on the same day at the same visit. This includes blood testing, that includes visual field testing, and this includes assessments by the endocrinologist, the hormone doctor, and the neuro-ophthalmologist who specializes in the vision effects of pituitary, all on the same day. This is a schedule that takes probably 4 to 5 hours in total for patients, rather than come in multiple visits. When we started to meet regularly about pituitary patients, we realized that the information required for good advice and decision making, what to do for these patients, required all those different components. And until that time, they were done in a fragmented way. So some patients went to see one doctor first, some the other, they had to wait in between, had to come back for different tests. So it resulted often in 2 to 3 visits to the same city instead of doing it in one time. So we decided to find a way to bring that together and make it a sort of a one-stop clinic where all these components, so the blood testing, the hormones assessments, the visual field testing, are done in a seamless fashion. This results in less time to take off, less time traveling for patients, and a reduction of the waiting times from only 1 time rather than 3 or 4 waiting times. Patients actually are surprised that it's that's well organized, and they simply love it. They realize that they sometimes have to come early, but they know exactly beforehand. We send them a schedule of where they're going and what is going to happen. They know about that. They know it's one time to come to London if they come from far away, and they know that they also get the results much quicker than they had before when it required multiple steps and multiple visits. So patients just love it and have said, why didn't you start doing this earlier?
In retrospect, I think things had gone wrong for about 10 years, and my family doctor kept testing and things weren't showing up. And when finally a couple of tests came back abnormal, she called Dr. Van Oom, who said pretty quickly and early in the conversation, have a brain scan. And so I got a brain scan, and from that point forward, I was in the hands of the pituitary team. And that was a year ago, and as I'll be saying, my life has been redefined by that engagement.